Welcome to Live with the Eczema Doc, brought to you by Clean Body, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. Today, we are talking all about our little ones who have eczema. And unfortunately, this is a large population of not only our patients, but of the people with eczema in the world today. A lot of them are kids, and not just children, but infants and babies and newborns. Right at the get-go, we're seeing people, little people with eczema. So today, we're talking all about kids' eczema. And we're pointing out 3 hidden root causes that your pediatrician might miss and the questions that your pediatrician should be asking. But because conventional medicine isn't really built in the way to look for root cause problems, your pediatrician may not be asking these questions and missing these issues. And then we're going to talk about, if you know the answers to these questions, how can that help your child to heal naturally? And I'm joined today by Tori, who is a Clean Body practitioner and eczema expert at Clean Body. So Tori, thank you for joining me in this conversation.
Of course. Hi.
All right. So we are going to be talking about why conventional meds don't actually cure eczema. How do we use the Clean Body method and naturopathic medicine for natural root cause healing? The top 3 root causes of your child's eczema, my top tips to get you started on your child's healing journey, and ways to learn more and your next steps. Okay. So, we are going to be talking all about your little one today. So if you have a child with eczema, let's definitely tune in today, okay? All right, so we like to say at Clean Body that there are some key root cause issues that are really at the root of eczema. Today, we're going to point out 3 of those big root causes because those can be 3 of the biggest ones for kids. And we really like to address those root causes because conventional medicines really just silence the symptoms. They are really not dealing with the problems. And that's why you might find yourself just, using these medications. And unfortunately, your child's eczema is not getting better, or maybe it gets better just when you're using the medications. And then when you stop, the eczema comes back. And then even worse, maybe you're seeing side effects from these medications. And so let's break down 3 of the top types of conventional medications you might see. And the first one is antibiotics. And this one might be used if you find yourself with a staph infection. And this is where, you're scratching so much, you got these open wounds, and then all of a sudden you get an infection on your skin. It starts to spread, it's oozing, it's weeping, and the doctor says, okay, we need to give you antibiotics. And they might start with some topical antibiotics, but if it becomes pretty widespread, they might give you, full body oral antibiotics. Now, this can be a problem because if you're basically with antibiotics killing off all the bugs there. It's not like the antibiotic is kind of selectively choosing just the staph. It is going to kill off good and bad bacteria. This is going to lead to gut imbalances. And unfortunately, which was our topic last time, this does drive yeast overgrowth. So if you're an adult who has ever taken antibiotics and then you end up getting a yeast infection, you kind of know what this is. So instead, you might get a yeast overgrowth on your skin. That could be malassezia, or in your gut, candida. And then also this leads to a problem. A lot of people are getting antibiotic resistance now. So let's say you take an antibiotic and nothing happens. It just doesn't even work. It's because a lot of these bugs are resistant, unfortunately. Our next class of meds is topical steroids. And this might actually be the first line of defense when we are thinking about, what is the doctor going to give you? And they might give you a over-the-counter hydrocortisone, which is where you start, and then you go higher and higher and stronger and stronger and stronger. And then it just really leads to this dependence. And unfortunately, this can lead to something called topical steroid withdrawal, which kids are more susceptible to because they are smaller, they have thinner skin, there's less body mass there. So when they are using these topical steroids, they are absorbing some of this into their system. And a steroid is a hormone in your body. And so this can be really detrimental to our little ones. This can weaken your skin barrier. So you might end up with very thin skin and, for short-term relief, but potentially long-term consequences. So I really like to stay away from steroids for our little ones. And finally, we have immune suppressing drugs. These are kind of newer. I didn't have these around when I had eczema, back a decade ago. But these are like Dupixent. These are typically injectables. They do have some topical immune suppressing drugs as well too. These suppress the immune system and they potentially work very well. So often the first line is topical steroids. If those don't work, then we go to the immune suppressing drugs. And unfortunately, these really don't resolve the root cause either, although they can maybe give some real relief for a little bit of time, but there are some serious side effects. So for example, Dupixent, the side effects with Dupixent end up being eye problems. And I've even spoken to someone who tried only 1 or 2 shots of Dupixent, ended up almost, 95% blind. And of course that might be, that's not everybody, but a lot of people, and I would say in my practice, when I've seen this, maybe about 50% of people get some eye issues. And some of those might even be tolerable, but sometimes it can lead to more serious issues. Okay. So we take a really different approach at Clean Body, and we are using naturopathic modalities, naturopathic medicine, and we're really using root cause medicine. So Tori, do you want to tell us a little bit about this 3-step Clean Body method?
Yeah, absolutely. So everybody that, comes to us, we use this 3-step method. And the first part is an evaluation process. So unlike, a conventional, approach where you maybe spend 5 or 10 minutes with the doctor and kind of get a quick overview and maybe some medicine on your way out, we spend a lot of time, especially in that first appointment, just doing a deep dive into the history of, your health and not just your skin. We want to know all the things, where you breastfed, where you were a C-section baby. We talk about all kinds of things to really do a thorough evaluation. And then we discuss testing. So we want to make sure that we're looking into the root causes and figuring out what is potentially behind that eczema, and not just, what just is treating the rash itself or the itchiness itself, but what's actually behind it. The second part is optimizing. So we have something we call the Clean Body Pillars, and it's 5 areas of health that are largely like in our control. So, and what I mean by that is we can at least, affect changes in these 5 areas. So that's nutrition, our movement, our environment, I'm missing it, our routine. And what's the last one I'm missing, Dr. Fong? It's
mental health.
Mental health, yes. Fight or flight, so nervous system regulation. And so that even in kiddos. So when you think about kids and even like tantrums or getting really worked up, especially when they're itchy, those kinds of things, those all play into the way that our body responds and heals. And so optimizing those areas is going to be really important. And I would say argue maybe 75% of healing is in these 5 pillars. So what you're eating, how much movement. With kids, we don't generally have as much of an issue with getting movement, but getting the lymphatic system moving. Products you're using, cleaning products. Are you burning candles in your house? What's the air like? Your water, all of those things. So these are all areas we can impact, every single day. And then support is going to be that individualized approach where we really decide what protocol you need. Are there herbs that we can give you? Are there nutrients that you're deficient in that we need to replenish? Maybe we need some homeopathy, especially for kids. That can be really a gentle approach, but really helpful. Are there topicals that are better options than the ones that you're using right now that maybe aren't great options? So the support is really going to be based on you and the testing and that evaluation process so that it looks a little bit different for everybody.
Yeah. And so, what makes this different from seeing your pediatrician or seeing your dermatologist? Well, the first part, that evaluate, is huge. So
Mhm.
you might have, let's say, a 15-minute visit with your pediatrician or your dermatologist, and sometimes they don't even look at the skin. Sometimes they just listen to the story for 5 minutes. They're like, okay, I know what to give you. Use this hydrocortisone, or use triamcinolone or fluocinolone, and let me give you this antihistamine, to lower the allergy process. And they're not necessarily listening to the whole story. They're not asking a bunch of questions, and those are the questions we're going to dive deep into today. They're not thinking about the lifestyle, the diet, all
Mhm.
of that. As Tori said, can play a 75% role in your child's process of eczema. And then once we ask those right questions, now we can say, okay, what is the right treatment? And instead of a medication to suppress the symptoms, do we address those root cause issues, which we're going to talk about in a minute, instead of just suppressing those symptoms? And sometimes there can be a time and a place, if a child has a very severe condition,
Mhm.
where we do need to suppress those symptoms while we're working on that underlying piece. But we have to work on the underlying piece in order to heal this eczema for good. Okay. I was that child with eczema. So I was born with eczema, and I had eczema until I was 30 years old. So that's now 12 years that I've been free of eczema. And so, I have a heart for children with eczema. I know what it was like. It's why I'm a naturopathic doctor right now. It's why I wanted to go into medicine. Okay. So the top 3 root causes of your child's eczema are gut imbalances. And this includes leaky gut and microbiome imbalances. And when you have these imbalances actually do show up on the skin. There is a gut skin connection. Toxin overload. And we like to say your child has a funnel. So when your child's funnel overflows, eczema flares. And leaky skin. When the skin is leaky, it triggers itch. Okay, so let's break down gut imbalances. So, Tori, tell us a little bit about how these gut imbalances end up in our children, right? Because a lot of people ask me, well, my daughter was just born.
Mhm.
How can she have a gut imbalance already? She
Yeah.
was just born. So
Yep.
tell us how that can be.
Well, the first thing to think about would be, is your son or daughter a C-section baby? So the way that we actually start to develop that microbiome is actually going through the birth canal. So if your daughter or son missed that because they were a C-section baby, they missed an important part of getting that healthy bacteria. And it actually takes a couple of years to build up that microbiome. So it's not fully developed until the child's around 2 or 3 years old. And so those first couple of years are really crucial that we get that good bacteria. So that's one way, as a C-section birth. Another thing is sometimes women have antibiotic use during delivery. So that can actually impact the microbiome of the baby as well, because we're killing off bacteria maybe that shouldn't be there. And a lot of times that's through an IV. So it's getting passed to baby as well. So that's another thing to consider. Food sensitivities, even breastfeeding, whatever mom is eating, baby's getting exposure to. So there can be issues there, especially in that underdeveloped microbiome. And then yeast, bacterial overgrowth, or parasites, which you actually can pass on to your baby as well. So those are all things to think about. Is that, even as a newborn, some of these can be an issue, but certainly, into toddlerhood, we have exposures to all of these things. And then as we get older into elementary age and all of those things, exposures are even up from there, of course. So gut imbalances are really, I would say, 99.9% of cases have some level, maybe 100 would maybe even be better just to say, but gut imbalance is a huge aspect of eczema. Almost every single person, child and adult alike, that we come into contact with needs to work on that gut health as a part of healing. And so starting there is always the case. And it's just not the thing you're going to find at the pediatrician, because it's just a different way of thinking. It's just a different mode of looking at health, is through that microbiome.
Yeah. And, parents will ask me, well, how did this happen right off the bat? And Tori mentioned, well, first off, we as mothers are giving our children our microbiome. So if we don't have a good one,
Yeah.
and then second, if our child is born via C-section, if mom took antibiotics, all of that. So your child potentially is not entering this world in the most optimal fashion, potentially. And then maybe your child is being exposed with formula right at the get-go instead of breast milk, which has so many factors in the breast milk that actually promote gut health. So, we want to do some testing if we think that this is the case. And as Tori said, 99% of children have some gut issue, whether it's leaky gut or microbiome imbalance. And we need to do some testing. So we might do some stool testing. We might do some other types of tests, even urine tests that will tell us a little bit about the microbiome. We might even do food sensitivity, food allergy testing. And this really opens up like, okay, what are we dealing with, and gives us that confirmation. We also love to see, what are you feeding your child? So we're going to ask people to journal like their plates of their food. Like, what are they eating? Is your child eating, a ton of packaged food, a ton of sugar? Sugar is going to feed that microbiome imbalance by feeding the bad, quote unquote, bugs in the gut and cause an imbalance of those bugs. Okay. So that's another part of that evaluation process, is like, let's look into what you're actually doing in your life. Often eczema is a disease of diet and lifestyle. So we can find it typically if we hunt for, the problem. And then we're going to make some changes, potentially optimizing nutrition, using things like herbs and homeopathy to target the problems we found. Let's say we found your child has like a parasite or a yeast overgrowth or something like that, then we do have to target it with really safe ways of doing that for however old your child is. Okay, so we have to look at this, and unfortunately, our pediatricians, our dermatologists are not thinking about this relation, this gut-skin connection that we are absolutely 100% seeing. And as Tori said, almost all of the kids who have eczema. Okay. And the next big root cause is toxin overload. And unfortunately, us moms carrying our babies can be exposed to all these toxins that our baby is already being exposed to in the womb via the placenta. So the baby's getting all these nutrients from us. In addition to nutrients, the baby can also get toxins. And then right at the get-go, when baby's born, unfortunately, baby could be exposed to all these toxins as well. Let's say your nurse was wearing all this perfume. Okay, the baby's already getting exposed to fragrances, which can be very toxic. Maybe in your birth room, you had candles going on, and that's toxic too. The cleaning agents that are used in the hospital room potentially could be toxic. The detergents that washed the blankets that your baby's being swaddled in, et cetera, et cetera, et cetera, right? So our babies are being exposed to toxins potentially right at the beginning, okay? And then it continues on. And unfortunately, we have a lot of toxins in our world today. In addition to in our homes, a lot of us have mold and we don't even realize it. And one of the reasons for this is our homes are just being built very cheaply, nowadays. And so mold likes to grow in those walls that are made with, cheap materials. And then, if we had water damage on our home, then definitely there could be mold. Okay. And then our food is laced with pesticides. If we're eating non-organic foods, even if we're eating completely organic, pesticides are potentially getting in there somewhere. And then we have heavy metals that are in our water. And so, we have so many exposures nowadays. So, people can ask me, well, my child was just born. How does she have all these toxins? Unfortunately, through mom and through the environment right when that child is born, okay? So we can do testing here as well, too. We can test for heavy metals, environmental toxins. We can test for mold toxins that are also called mycotoxins. We do a lot of education with our patients, swapping out products. What should you be using instead? Because, so we'll have our patients even journal those items like, okay, Send us pictures of everything you're using, from your soaps to your laundry detergents to all the creams and lotions, and potentially people have to change everything out, okay? What are you cooking your food in? Those pots and pans might be toxic too, okay? And then we really need to do really targeted treatments for whatever we find. We don't just want to detox out of nowhere, especially a child, like heavy metal detox, and we don't even know if this child has heavy metals. So if we find that there are heavy metals, if we find that there are environmental toxins, then yes, then we will want to gently help the body to clear these toxins out of the system, okay? And finally, we have leaky skin. And this is a big one because unfortunately, our babies are born with less than optimal skin barriers, and they are born with less of what we call natural moisturizing factors. And these really help that barrier to be strong. And then we have some genetics. So if you have eczema all up and down in your family, then your child could be born with a filaggrin mutation, which is a gene that when it's mutated, you also will have a weaker barrier. So this weaker barrier causes more microbial imbalances on the skin. We could see yeast growing. We could see bacteria growing a little bit easier on this leaky skin. And then for some people, maybe you're using a harsh soap on your baby or your child, and that's causing leaky skin. Maybe you're using other chemicals with fragrances, like moisturizers with fragrances. That could also cause some irritation and leaky skin. And maybe if you're breastfeeding your child, you're low in certain nutrients like omega-3, vitamin D, zinc, and these are really important for making sure that barrier is really strong. Or if your child is eating, your child is older, maybe your child is just not eating any vegetables, no fish, not getting out there in the sun, etc., then we need to do all those things to really bring those nutrients in, because those nutrients really allow that barrier to be stronger. So if you have a baby with eczema, then that baby has that leakier skin just in general. But we do see that the skin gets less leaky at around age 2 to 4 years old. So that's where you might see your pediatrician might say, "Oh, your child would just grow out of it. Don't worry." And that can be true for some kids. Okay, so for those with just the leaky skin problem, we could see that around 2 or 4 years old, maybe they might grow out of it, quote unquote, because their skin gets stronger. But there are things we can do during infancy to really support that skin barrier, make it stronger. And we want to do some good journaling here to see what mom's eating, if she's breastfeeding, what child is eating, if they're old enough to eat. We could do some testing as well. We could look at zinc levels, vitamin D levels, omega-3 levels, and we like to really recommend some very specific topicals. We can see if your child has like a yeast overgrowth. We might choose some specific topicals that don't feed the yeast. If we see that there's a lot of staph infections, we might do something different. And we really want to just kind of support, because the baby doesn't have those natural moisturizing factors in the beginning. Around 6 months, it gets better, and it just gets better and better and better as that baby gets a little bit older, okay? So we might want to support all of these nutrients that are really helping that leaky skin. All right, so let's talk about the top tips to start. And we're just going to kind of briefly go over this today. We are going to dive deeper into this in our next live, which is in 2 weeks. And we're going to dive really deep, and we're going to really hold your hand and what can you do? Like, what can you do right now? But, just to kind of start off with, Tori, just tell us what some of these top tips are where people can get started. And then if you want to dive deeper with us, make sure to follow us on Instagram, follow our podcast, because this becomes our podcast as well, and follow us on YouTube, and make sure to watch that next or listen to that next live and podcast, because we're going to dive into the tips. So Tori, tell us what the tips are.
Yeah, so the first thing is pretty simple, and I think everyone could work on this, is just start keeping a journal of both what you eat or what you're feeding your child and symptoms. And a lot of times I'll meet with people and they'll say, "Well, we've tried eliminating foods and I didn't really notice a difference." And what I usually find is that first of all, maybe it hasn't gone on long enough. Maybe the right foods haven't been eliminated. And not that eliminating foods is going to be the cure, but it certainly can help the symptoms. We still have to address what's going on beneath the surface. But just having a symptom journal that we can compare with the food could be really helpful. So that's the first one. And then processed food. If you are feeding your kid, goldfish for every snack and, everything that you give them is in a wrapper, that is a clue that you need to start looking at more like whole, real foods. And that can be a huge help alone, is just getting that processed food down, because so much stuff is in processed food, sugar and chemicals and food dyes and all of the things. So reducing that will help a ton. The other ones would be like hydration, especially water, not juice and milk and all of those things, but just proper hydration. And then cleaning products, I think, is a big one that people don't maybe think about, is just what are you cleaning your house with? What are you cleaning off the high chair with that your kid puts all of their food on and then picks it up and puts it right into their mouth? And so making sure those products are good. Movement, which is great, sweating if your child can tolerate it. I know sometimes with eczema, sweating can be pretty painful. So if your child's in a place that they can sweat, we really would like that, because that helps our detox pathways. And then gut healing food. So if you can do things like the sauerkraut and fermented foods, those aren't always a fit at the beginning of the journey. So please keep that in mind. If you do some of those and you feel like you notice your child is getting bloated or having discomfort, maybe something we need to wait. And we'll go further into that on our next call. But bone broth is an example of that. Ginger, turmeric, things that are anti-inflammatory. And then the nervous system, I think, is a huge piece we've touched on a few minutes back. Calming the nervous system, even in babies, I think is huge, just providing that comfort. Tantrums. I actually talked to a mom earlier today that talks about how her child gets into a panic when they're in the bathtub because it hurts the skin. And so that is a nervous system that it's really in fight or flight. So managing the nervous system and helping, get into a calm, restful state and good sleep. And then the topicals, which we've touched on a little bit, but the right topicals matter a whole lot. And some of the ones that you can just go to Target or Walmart and buy aren't really always the best options, just depending on what's going on with the skin.
Yeah, and we'll dive deep into these topics even further in our next live and podcast. So definitely check that out. It'll be in 2 weeks on Thursday at 12:15. And we'll dive deeper into just kind of how do you actually do this and implement this into your life? And we have some clean skin topicals. It's a good place to start is hypochlorous acid. So we have Clean Skin Calm. That's a great one. And then we have Clean Skin Restore, which is a probiotic. So this kind of addresses that microbiome imbalance that we were talking about. And then for ointments or creams, I really like people to choose those very particularly based on their eczema, because you might be putting something on your baby or your child's skin that's actually exacerbating it. Because let's say there's a yeast problem and you're feeding that yeast with oils, or let's say your baby might actually be allergic to coconut and you're putting coconut oil on your baby or your child. Okay. So I think these two recommendations here are great for kind of like everyone who has eczema. But that third part, which is how do you moisturize the skin for eczema kids, is kind of specific to whatever your presentation looks like. And we can go into that a little bit more in our next live podcast. We're going to break down a little bit more like where do you get started if you have a kid with eczema. And if you want to get started now, definitely download our free Eczema Doc's Guide to Kids Eczema. You can download it at cleanbody.health/eczema tools. Again, cleanbody.health/eczema tools. And you can get all of our free guides there. We have a free guide on fungal eczema as well as kids eczema. Somebody here said, my daughter is 19 and has had it since my husband passed 5 years ago. First of all, I want to send my condolences. I'm really sorry to hear that your husband passed away. And the second is I do want to actually point out here that yes, trauma and the clean mind aspect of things, that emotional component can be huge in an eczema process. Okay. So, first I would recommend that there's some healing that's done. And sometimes that's not enough, but that's a really good place to start, is really start healing that trauma. Some types of therapies I like are EMDR, that's eye movement desensitization, EMD and reprogramming. So EMDR. And then I also like this type of treatment called emotion code. In my practice, I kind of put all those things together and I do sessions that are called clean mind sessions. So that's also something that's available to you. And you can see that at cleanbody.health/clean mind. And someone said, I think they're saying their child is on Adbry. If that's true, Adbry is an injectable that is one of those immune suppressing drugs that we were talking about earlier. And again, this is not, an answer, a long-term answer. This is a great short-term answer to help lower that inflammation so that we can actually work on the underlying problems. Dr. Fong, what brand of lotion or cream do you recommend for a baby who is suffering from eczema? And again, as I mentioned, every person's eczema is going to be different. So we're going to use different creams, lotions, ointments, etc. But you can see a lot of my recommendations at cleanbody.health/products. And you can navigate to the skin and eczema section, and you can kind of see a lot of the lotions and creams that are very clean that I really like. Okay. My son only has a patch on his right of his eye. It itches him at times, but not a lot. Okay. So it's hard to say without seeing a picture, without knowing more about the picture of the eczema, to give you, any help here. But there's a reason that patch keeps coming up. So, and often it can be really weird. It can be something like eating eggs or something like that, or eating gluten, and you stop eating the gluten and boom, that patch goes away. So even with just that one little patch, sometimes that can actually grow into something much larger. So it's, people will tell us, like, who have eczema all over now, oh, it started with a little patch and then it grew and then went here and then went here and then went here. And then all of a sudden it's like all over now. So we want to avoid that. So you want to figure out what the trigger is for that. So as Tori mentioned earlier, doing some really good journaling, like looking at when that patch gets worse, when it gets better, is a good idea. And see, okay, what did they eat right before? Sugar. Okay, sugar fed it. If sugar fed it, now the next question is, why did it feed it? Is it because this child has a yeast overgrowth? Is it, just the sugar itself, which is toxic in itself? So we need to figure that out. So that's why working with a team can be really helpful. But I would say, even if it's just that one spot, I would say don't just ignore it, right? Yeah. Think about it and maybe just start doing some journaling, maybe start some of the tips that we see in our guide. Again, you can download that guide or come to our next live and we'll dive deeper into those tips. Okay. Someone says, my child behaves better on Focalin, but he says it makes him feel like a robot. Should I increase the dosage? Okay. So, I can't tell you about dosing. You would have to talk to your prescribing physician in terms of the dosing for the Focalin. But what I will say is it's just like those conventional medicines for eczema. This is, something that we would want to understand, is there a root cause that we can actually dive into? And there could be a root cause in the gut, first off. I know that we said that gut is the main issue for skin, but it actually can be one of the main issues for mental health imbalances as well. And Tori, maybe you can go into a little bit of that. Why does that occur? And what can we see as root causes for a child who needs to be on Focalin?
Yeah, so the gut and the brain are connected via the vagus nerve. So, think about how you can get butterflies in your stomach, or a nervous stomach. When you're nervous or excited, you kind of can feel it in your gut, or even the term gut feeling kind of originates from there. So they speak through that vagus nerve. And so oftentimes you could have mental health issues that are related to an imbalance in the actual gut and the microbiome. So it's definitely an area to explore. And to see, if there's overgrowth happening there, if there's some good bacteria that's missing. That's often the case, that we'll see that maybe a whole bunch of that healthy probiotic is just completely depleted. And there's some research on certain bacterial strains being more important, and different pictures of like mood and attention and focus and all of those kinds of things. So the gut is definitely connected. And so that medication, although it can help, it's the same thing. It's sort of a Band-Aid. So it's not really healing anything. And so it's not something that if your child's on it, we can still at the same time be working on those root causes if you have that goal to eventually be able to get them off that medication in a healthier way. So that's definitely something we can help with.
And the person saying with the son with the patch on the right eye said, we have a dermatologist appointment because now months later, the pediatrician said maybe not eczema. And yes, I would say whether it's eczema, whether it's not, whether it's something else, there's going to be a root cause. And all of our skin problems are just a reflection of an imbalance underneath. So even psoriasis, acne, eczema, you name it, all these skin problems are just a sign that something deeper is going on. So the dermatologist may then give you another medication to suppress whatever that eruption is on the eye, but still not necessarily going to get to the root cause. Unless you see maybe an integrative dermatologist, maybe an integrative dermatologist may look into diet and other things, but that is more rare, I would say. Okay. So I would invite you to actually download our eczema guide, even if you are thinking maybe it's not eczema, because a lot of those tips we have in there will actually help with any kind of skin imbalance. Okay. Recommendations to help my daughter when they just want to keep itching the skin. Oh, this is such a hard one. And I know being a parent, seeing your child scratch, it's like the hardest thing because you can't, you feel like there's nothing you can do to stop it. So in terms of itchiness, why is the itchiness happening? So sometimes there is, there's inflammation that's causing that itchiness. So we want to turn that inflammation down. One of the easiest ways to do that is with cold therapy. So you could do ice packs. You can do a ice roller. We have that on our product recommendations section. And just things that are cold. You can even do a cool shower, a cool bath, and that could help lower that inflammation. So that's one thing that you can really help is just cold. Okay. The other thing is there is actually this acupressure point. It's called large intestine 11. It's right here on the elbow, and you actually can just massage it. And you can massage it for your child and have the child breathe, and you stay calm and you breathe with your child, because often the itchiness, it just escalates and escalates and escalates and escalates as you're freaking out, your child is freaking out, and we want to just calm things out. So I would first take those deep breaths, then take your hand and massage that large intestine 11 point right here. If you guys can see me, it's right here in the elbow. And that can also help that itchiness too, just kind of calming down, okay? But truly, when we want to think about how do we lower this itchiness, we got to think, okay, what is actually causing this itchiness? So what's causing that inflammation to happen? And we might pinpoint, if you do some good journaling, like, oh, it's after she eats this food, or it's after she does this, or it's after she, plays around in the grass, or, you might pinpoint what is causing that itchiness as something that can also help as well too. And then someone said, unfortunately, she gets cold hives. Okay. So this child seems to have, potentially a higher than normal allergy histamine process going on. And so we then need to figure out why that's happening. Okay. Because the hard thing is you can do a lot of things to suppress that itchiness from the outside, but none of them might work if you are still doing something that's causing that itch. Like let's say she's sensitive to gluten and she's eating gluten all the time. She's eating gluten all day long, and it just continues to cause that inflammation on her skin. And then you're giving her something to suppress it, but you're kind of lighting the fire and then turning it off, lighting the fire, turning it off, lighting the fire, turning it off. That itchiness may not get better. Okay. So we have to figure that part out. And if she has cold hives, then, I would say that allergy response is a little bit higher, and we need to figure out what's triggering that allergy response. Okay. And that's where that evaluation is really helpful. So, you might be someone who might be interested in doing that and getting $50 off, using the code LiveKids1. Okay. Eczema is only on the hand. What can I do for hand palm eczema? No eczema elsewhere. Eczema is only on one hand. Okay. So all of the above that we just said, we need to evaluate like what's causing it. But what I will say in my practice with hand eczema, I often find a very strong stress component. So, and it's a weird correlation, but I find that those people with hand eczema often have a very big stress component, or you are in a job or doing something where you have to use a lot of hand cleansers. Maybe you're a nurse or someone like that who's like washing your hands all the time, because there is such thing as being too clean, where you're actually killing the microbiome on your hands. And when you're killing that microbiome on your hands, you are leading to potentially eczema on the hands. Okay. So stress, and then hand just kind of cleansing and using like harsh things on the hand is what I typically see with that. Tori, do you have anything to add to that?
I just talked to somebody yesterday about her hand eczema, and same thing. She works in an environment where she has to wash her hands a lot, and the soap you use matters. So all that like antibacterial soap out there, in theory, sounds like a great idea, but it's killing all of the good bacteria on your skin too. So if you are a person that has to wash your hands a lot, getting a cleaner version of soap that doesn't have all of those agents is going to be super important. And then I think weather change plays into the hand eczema as well. As the weather gets colder and kind of dries people's skin out after washing their hands, I think we tend to see eczema flare up there too. So making sure the moisturizer is very individual, but I think once a day, not over moisturizing either. Just after you wash your hands, maybe making sure that you're getting good quality moisturize on your hands as well. And hand sanitizer is a no-go. So if you are a person that uses hand sanitizer, you probably aren't. If you have hand eczema, I would imagine it would be really painful. But if you have eczema anywhere else, please do not be using hand sanitizer.
And someone just said the hand sanitizer is worse with toxins. Yes, absolutely. So there is actually a toxin in your hand sanitizer that we test for. And those people who use a lot of hand sanitizer tend to have a lot of this toxin. And again, there's such thing as being too clean. Like, we need to live in a world with bacteria. Yeah. And when we're too clean, when we're washing our hands too much, this can actually be at the root of hand eczema as well. And then that's a great recommendation, Tori, is just make sure you're using a nice, clean, organic hand soap. And then, I think soap is also controversial, that we are doing too much cleaning, that you could also think about using like a probiotic soap instead. That's like putting probiotics on your hands. Clean Skin Restore that I talked about earlier is a probiotic spray. If you're doing a lot of hand washing, you might want to think about like spraying probiotics on your hands after you wash your hands. So that's something to think about. And then we always have to go deeper. So the emotional piece, but hand eczema could also be gut imbalances and all the other things that we've mentioned.
Yeah.
Okay.
And one more thing, Dr. Fong, I just thought of rings, watches, like whatever metals, like if you have anything like that on your hands, that could play into it as well, that maybe you're not thinking about. So that's something to think about too. Like what is actually touching your hands? Or like, I think of one client, Dr. Fong, that we've had with hairdressing. If you're like a hairdresser or your hands are touching a lot of chemicals, those kinds of things.
Yep. Absolutely. And, this person said, yes, constant hand washing. Yep. So we got to handle that. If it's because of your occupation, then we have to figure out, maybe you can get a different soap. Maybe you can spray your hands with probiotics afterwards. Maybe you can moisturize right afterwards. Maybe you can take a little break from work if it's at work. Okay. Someone says, mine always itches at a particular time at night while sleeping, mostly around 12. And you put 12 p.m., but I think you mean 12 a.m. And how can I help? Okay. So nighttime itching is very, very common for lots of different reasons. One, it's because you're just being quiet, right? You're not doing anything. You're trying to sleep and you now realize that you are itchy, which you might have been itchy all day long, but you might just be realizing it. That's one. Number two, we have a hormone called cortisol, and you might find that sounds like hydrocortisone. And so, cortisol levels drop at night, and that could affect our itchiness because cortisol actually lowers inflammation for us. So when those cortisol levels drop, sometimes we can get itchier at night. And around 12 a.m. might be a time that we get itchier. We maybe want to think about like your sleep hygiene, in terms of your bed, your whether there's your mattress is like toxic, whether there's a lot of dust mites in your mattress, on your blankets, those types of things is another thing to think about. Maybe even you do a lot of breathing while you're sleeping. So even like do you have a air purifier in your room? All those things we want to think about. Tori, is there anything else you can think about for nighttime itching?
I would say two other things come to mind. One would be how cool is your room? If you're sleeping in a room that's a little too hot, that can agitate. Also, the material of your sheets is a big deal. So if you don't have like 100% cotton or like bamboo sheets, think about that. And then what did you eat before? What was the last meal you ate before bed? So some people that have no issue going to bed at night, but then wake up in the middle of the night are actually having a glucose reaction. So it's related to the food that you've eaten before you went to bed. So I would evaluate what is the last thing you ate? Is it carbohydrates with no protein? How close to bedtime are you eating? Those kinds of things, because what you eat before bed actually has a huge impact on how well you sleep and the type of sleep that you get. So especially if it's always at midnight, you may just be going into a lighter stage of sleep and it's just enough for you to notice that you're itching and then it kind of wakes you up completely. So pay attention to those meals hours before that.
Yep. And she said, sorry, I meant 12 a.m. She's also always itching as soon as I take her socks off or pants, and she has eczema spots behind the knees and ankles. Yeah, it can be difficult because being in someone who had eczema, I know when it's covered, sometimes you kind of like forget it's itchy, or there's like something against your skin, so you kind of forget, and then you take it off, and then all of a sudden it just feels itchy because it's open. So again, I think what we need to do is find out why she's so itchy, like what's actually causing this inflammation, rather than worrying about all of the necessarily like all of like, okay, it happens after that. But those are good kind of tools for us to understand what we need to be looking at. But we really need to be getting to the root cause, right? Instead of thinking about like, oh, what topicals to put on. So you are asking, how can we get in touch to work with you and discuss your 21? Okay, so your child is 21 months old. Okay. Yeah, so you guys can go to, if you're on Instagram, go to the link in my bio, book an eczema evaluation. Since you're attending this live, definitely use the code LiveKids1, and that one will give you $50 off. The evaluation is normally $97, but it'll drop down to $47. So I would definitely recommend doing that just right now. That expires on Saturday. So if you want to just do that right now so that you get that discount, okay? And then what are your thoughts on the new symbiotic Persephone and long-term use for toddlers? Yeah. So I didn't know what this was. I actually just looked it up while Tori was talking. This looks like it's a probiotic and prebiotic combination. And so I guess they're terming that symbiotic. And in general, I think these are good things to consider, but sometimes depending on the presentation of your eczema or the reasons behind the eczema, sometimes probiotics can tick it off. Yeah. So sometimes probiotics can tick it off, and you might see you take a probiotic, your eczema gets better. You might take a probiotic, it gets worse. Yeah. And we don't like to give necessarily supplements just blind. We like to do testing if possible. So we could run, instead of just taking that symbiotic supplement, you might want to run a stool test on your child so you can actually see which probiotics are low and which ones you might want to take. And maybe it's not that they need probiotics. Maybe they just have dysbiosis and they need something else, but it's not low probiotics. It's that they have too high of something else, right? So, Tori, I don't know if you have anything else to add there.
Yeah. And I would say one of the biggest things that I find is a lot of people are just grabbing probiotics, which makes sense. There's a lot of marketing out there for a variety of probiotic companies, but a lot of them cause histamine issues. So with eczema, we often see high histamine and issues with histamine, kind of like the person earlier saying that their daughter gets hives and things. So if you're constantly giving your child strands of bacteria that produce more histamine in their gut, then they're actually going to get itchier and flare up more. So it's actually going to be counterproductive. So there are some strands that have less histamine response and some strands that have more. So this is all reason to work with a practitioner, because you wouldn't know that without, knowing what, symptoms to look for, looking at, a stool test, those kinds of things on which ones might be helpful. So, definitely think about a stool test and an eczema evaluation just so that you know if that is an option to take or not.
Thank you for joining Live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers, or download my free eczema relief guide for quick practical tips to calm flare-ups and help with your sleep. If you found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. Use the code LIVE30 to enjoy 30% off as a thank you for tuning in. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.